Hello, I'm Karen Elliott. If you're one of those people who's tried everything and the pain just gets worse, or if you've ever been told by a doctor, I'm sorry, you're just going to have to learn to live with this, or if you want to prevent health problems you see all around you, not just for yourself, but for your children, then welcome to a program that may not only change your life, but your entire understanding of health care. We're going to tell you about a procedure that cures nothing, but because of its ability to restore body function, apparently can help hundreds of conditions. The guest we have with us today was once an invalid, confined to bed in agony, unable to even dress or feed herself. Today, she appears on television, radio, and in newspapers around the country, talking about a little-known procedure that restored her life. Would you welcome the founder of the National Awareness Campaign for Upper Cervical Care, Luella Harris. Luella, you grew up in Kenya, East Africa, where you contracted polio. Am I right?
That's right. In fact, before you go overseas, you have to have all kinds of immunizations, and exactly 8 months after I was given the polio vaccine, I contracted polio. So I've grown up living in a wheelchair and working with braces and crutches, and that is an inconvenience, but that is not an incapacity. I got married, got my master's degree in counseling, and had a very, very active life, but then 5 years ago, I began having pain crawl up this left arm, into my shoulders, down the right arm, and that was terrifying for me because, see, Karen, this is how I function, okay? These are my hands and my feet. In fact, I shook hands the other day with this little old lady, and she felt the calluses on my hands, and she says, darling, you need to use hand cream. And I says, well, honey, you just shook hands with my foot, you know? And so when that pain began coming in, it was a life-threatening situation. By 6 months, by the time it started to 6 months later, I was completely bedridden. Richard had to dress me and feed me, and the pain was so bad that I could not even turn my head and sit up and watch television. Well, we went from doctor to doctor to doctor to try to find some help, and the only thing they were able to help me with was drugs, medication, and some exercise. When in a case like that, you'll try anything, Karen, okay, just to get rid of the pain, to try to have a life again. Well, we had heard that chiropractic could help, and when I got in there, it was like walking into a science lab. There was so much technology and so much precision in what they did. They focus on one thing, and that's the atlas, the top vertebra of the spine, right here, just right at the brainstem area. And they did a neck scan. They did all this type of measuring to see what the problem was. They did a neck scan right here to see if the atlas was out. Because if that crazy 2-ounce bone right there at the top of your spine is out even a fraction of a degree, it can cause health problems from head to toe. So they did the neck scan, and then they did a leg check, because one of the indications that your atlas is out is one leg is shorter than another. Well, my right leg was a good 1 inch and 3/4 shorter than the other, and I thought that was because of polio, not because of the atlas. And then they took this series of x-rays focusing on the atlas in 3 different planes. And then that doctor spent 45 minutes analyzing the shift and the tilt and the rotation of the atlas. He spent so much time, all this preparation, and they came in, and I just laid down on this table, and he said, now I'm going to give you the correction. And this type of chiropractic procedure is done either by hand or by instrument. If it's done by hand, it feels like a soft massage or a quick wrist thrust or a light tap. And just focusing right here, and that's all he did, okay? So he said, now just lie back and relax. Now, I hadn't been working in months, Karen, and I'm thinking as I'm staring at the ceiling relaxing, this guy looks good, but he's a quack, you know? He has done nothing for me. And then about 20 seconds after that atlas correction, I began to feel the pain just come out of my body. It felt like water coming out. Well, and not only that, my whole body began to feel like it was shifting. It was like my whole right leg began to move down, because when the atlas is tilted out of the proper position, it literally can pull one shoulder down, one shoulder up, and the whole pelvis distort and pull a leg up. My whole body began to shift right there on the table. Well, Richard and I were just blown away, because we had fought this for 18 months. My medical doctor has said, just medications, nothing can be done for you. And when I married this man, I was so active, and he ended up with having to treat an invalid, and that just was not something I could deal with. And every time I think about that experience, our backs were against the wall before we knew about this upper cervical care. Well, I was crying on the table basically, and the next thing they had to do was they take an immediate post x-ray or an immediate heat reading, because this work has to be so precise. They've got to make sure they've done it right. After that, I got back in the car, and by the time we got into the car, my low back pain was gone. Now remember, Karen, he only touched me here, all right? And that night, my sleeping patterns began to change. I've always had trouble sleeping. Well, in 48 hours, though, that pain began rushing back because the Atlas had been out for so long that it just didn't want to hold the position. So the first month or two of staying under care was grueling, being in the office and getting it set. But the pain began to decrease until the point was, by the end of 4 months, I was 70 to 80% completely pain-free, back to work, active again, and very, very pregnant at age 39. Now, this was not something Richard and I had planned, okay? He did not write it in the Daytimer. And so we went to the chiropractor's office and we said, we have something to tell you. And he said, you're pregnant, aren't you? And I said, I would like to know how you knew that. And he said, well, actually, not every woman, but numbers of women that get under my care here with this procedure, after about 3 to 4 months, are able to get pregnant. And I'm telling you, he did not tell me that in the initial consultation when I went in. This was absolutely new news to me. He said, Luella, you don't understand how huge the impact on the health of the entire body and all body function can be when the Atlas is out of position, where the brain cannot communicate with the body and the body back to the brain. But instead of me telling you that, he said, you need to meet some people. So we began to meet a lot of his patients. We met people with migraine headaches, sciatica, attention deficit disorders, knee problems, feet problems, I mean, digestive problems, hearing problems. There didn't seem to be, it wasn't about the conditions. In fact, this procedure is not about conditions. Upper cervical chiropractors don't treat conditions. They simply correct the Atlas so the nerve interference between the brain and the body is removed and the body can function again. Well, when Richard and I knew that this was huge, we had suffered so long because we just didn't know about this. And I said one day, honey, I don't know how we're going to do this, but we have got to form a nonprofit educational organization on a national scale that tells people about this procedure that's available. And since then, we have had the joy of seeing hundreds of people's lives turned around with all kinds of conditions that had been just like us, tried everything, nothing worked, and all they did was simply get their Atlas examined and corrected.
Luella, we have some other upper cervical patients in the audience. Let's find out what they've got to say. Start in the back and work forward, okay? All right. Hi.
Hi, Karen. My name's Paul Anderson. I'm from Sioux Falls, South Dakota. And I had this dull hip pain that I went and saw a sports doctor. And they gave me cortisone shots, worked therapy. And I lived with that for 5 years until I met this doctor of mine. And he showed me the adjustments, and I said, heck, I'm going for it, and I hadn't had the pain since. And with that, I also had chest pains that's been going down the side of my chest, and while I was doing that, that took care of that, and now I'm going on having a happy life, doing things, going out, working out, golfing more, playing more softball. A small procedure, but it's been a big impact in my life.
You've got your life back.
Yep.
Thank you for sharing. And I think you had something to share.
Yes, ma'am.
Great.
My name's Jody Cabina. I'm from Roswell, Georgia, and I'd like everybody to know that I started seeing chiropractors at age 17 for chronic back pain, and then at age 33, I was diagnosed with severe chronic fatigue. I couldn't work. I was in bed. I had severe pain. I tried everything. I educated myself. I went to different healers, tried different modalities, and I would get some relief, but it just was not solving the problem. And so I had known about upper cervical for some time, but I could not understand how adjusting one bone could help me when I tried all these other forms of chiropractic, and my back really wasn't any better. So out of desperation, and several people highly encouraging me to try it, I tried it, and after one adjustment, the pain left my body immediately by the time I'd left the office. And I'm working over 40 hours a week, my energy's back, the depression's gone, and before that, I had no hope because I had tried everything.
Thank you so much for sharing your story.
Thank you.
And I believe you had one to share.
Yes, I certainly do. Thank you. My name is Mary Speaker. I'm from Fort Lauderdale, Florida. And I had been declared totally disabled from saline breast implants, chemical contamination, and it left I had many ravaging symptoms from these diagnosis: multiple sclerosis, a brain tumor in the postfrontal area, systemic lupus, 100% disability, chronic fatigue syndrome. Like you, I was in bed, severe fibromyalgia, malabsorption, so on and so on and so on. And these were all diagnosed by board-certified physicians, university-based. And it was a very discouraging situation, and many of the modalities that I used to try to get better were hospitalization for traction, and I used sauna therapy, NSAIDs that really didn't help at all. I used physical therapy sessions which weren't effective at all. It just goes on and on and on. And in 1984, I was introduced to a beautiful upper cervical chiropractic, very compassionate doctor who in 2 months actually changed my life. And at that time, I was in a severe major pain syndrome because of the severe allergies. I couldn't eat any food, and even taking an aspirin would throw me into a major pain syndrome. And as I just said, within 2 months of his very light therapy, all of a sudden this pain went away. I felt naked. I didn't know what it felt like to be without pain. It was very difficult. It used to hurt to think. All of a sudden my brain became unglued and I could think. Remember, I was considered totally brain dead at one time with severe polyneuropathy. And so my life began to come back, and I really feel it was the hand of God that led me to this beautiful chiropractor. Oh. And
Mary, that's amazing.
well, God is good, isn't he?
Amen. Thank you so much for sharing that. You know, there are only about 2,000 doctors worldwide trained in this procedure, and we're fortunate to have one of them with us today. Doctor, let's say I have pain that is in my arm. Why do you just treat the top vertebra and not from where the pain originates?
Because we found over the years that when the atlas is out of its proper position, it can cause the entire body to be off balance and constrict proper nerve flow from the brain to the organs and the limbs and throughout the body. Your feet may hurt, your arms may hurt, but the cause of the problem may not be in those areas at all, but in your neck. Look at this. If the atlas, the top vertebra in your neck, is twisted, shifted, or rotated out of its proper position, it can cause one shoulder to be higher than the other, one hip higher, and make one leg appear shorter than the other. All this can create pain in different parts of your body, from your head all the way down to your feet. The atlas being out of position could cause the whole body to be imbalanced, and because the atlas is right there at the brainstem, if it is out of position, it can constrict vital nerve flow to the organs anywhere in the body. If this continues to happen for a long period of time, it can cause serious degeneration of organ, muscle, and of tissue.
Has anyone else come such a long way to share a story? Oh, all right, let me zip around here and we'll get you all. All right.
I'm Sandy Eslick from Tulsa, Oklahoma, and I've had chronic muscular pain as long as I